We are live. We are live. I'm Dr. Frita, and welcome to Medical Monday, where we talk about celebrity health and all of the hot health topics in the headlines. I hope y'all are having a wonderful Monday because I have some evidence-based medical information to share with you. We'll start off with my favorite game, Myth versus Fact. And we'll talk about Dolly Parton. Good old Dolly Parton. She had to cancel a concert because of kidney stones. So we'll talk about kidney stones, the signs, the symptoms, the treatment, the prevention, and what Dolly Parton has to say. And then we'll get into our weekly dose where I give you a fresh take on the health headlines you can't get anywhere else. We'll start off talking about Lori Harvey, the socialite, and actually, I'm learning, a quite intelligent young lady. Well, she shares her health journey and how she feels like she was gaslit by her doctors. She shares about her diagnosis of endometriosis and PCOS that she had been living with and suffering, quite frankly, and the doctors, she felt kind of wrote her off a bit. And so we'll talk about those diagnoses, how common they are, and how to recognize them, what to do. And then we'll talk about your watch. Do you use your watch to tell you what time it is? Well, guess what? The Apple Watch says that your Apple Watch can actually tell you your blood pressure. Y'all know I'm a high blood pressure doctor. So is this really true? We'll talk about it, and we'll talk about the possible implications, what this can mean for you and your health. And then let's talk about airplanes. Do y'all fly? Yeah, I know you do. Well, there have been toxic fumes at 30,000 feet. Yes, in some airplanes, there have been cabin fumes, which can cause health issues. Okay. So we'll talk about the truth about cabin fumes, how common it is, and how to recognize the symptoms and what to do about that. And then we'll talk about Dancing with the Stars, Carrie Ann Inaba, because she has been very open with her health journey. She has multiple chronic illnesses. Can you believe it? She's been dancing with multiple chronic illnesses. And so we'll get back into the theme of invisible diseases. And of course, I'll give you some breaking news because I had to share some breaking news on a news channel, okay, about some very important things that are going on in Washington, D.C. So go ahead, give us a like as we get started. I'm Dr. Frita. This is Medical Monday. We're about to have a good show. Hello, hello. We're live. I'm Dr. Frita. This is Medical Monday. I'm not hosting this on my own. Shador, Miss Shador, my office manager and co-host, please come to the front of the stage. How are you doing, Shador?
I'm pretty good. How are you?
You know what, Shador? I was just thinking, what happens if one day I say, please come to the front of the stage and nobody comes? I was like, wait a minute. Oh, shoot. That would change everything. How was your weekend, Shador?
Weekend was full of hair. How was yours?
Oh, doing hair. Mine was actually quite eventful. We did a little basketball, the regular, but my most fun event, Shador, my Aunt Wanda McCrae, hello, and my Uncle Keith McCrae, Dr. Keith McCrae. Well, my Aunt Wanda was actually the host of a Links event, okay? The Links, and they do wonderful things for the community, including raising scholarship money, and they raise a lot of scholarship money. But while they're raising the money, we have a bit of fun because there was a day party yesterday. And if you put up some of the photos, Shador, please. So my Aunt Wanda was there. A bunch of my cousins were there. It was a sold out event, which was actually pretty cool. And
get photos from your event, Dr. Frita.
What's that?
Photos from your event.
Mm-hmm.
No, I don't have those, Miss Lady.
Uh-oh, they must not have gone through. Let's see. They sure didn't. They're sitting right here, unsent. Anyway, I'll be posting them. If y'all go to my IG story, I already posted some of them. But I'm really excited because my Aunt Wanda McCrae, who's married to my father's youngest brother, Dr. Keith McCrae, he's a dentist in Gainesville, Georgia. At any rate, we had dancing. A lot of my other cousins were there. Trey, Heather, Sanita, a lot of good friends were there. Miss Betty was there. Anyway, my sister and I went and we just danced and danced. The DJ was wonderful. And I want to give a special thank you to Miss Patricia Wilker. She's someone who actually, as it turns out, is a childhood friend. She's someone she and my mom have been good friends for years and years back when we were in Jack and Jill. but she actually requested a book for me to take my book and sign it. And she's been watching the channel. She was sharing with different people. I didn't even have to try to network for myself. She was telling people, hey, are you watching Dr. Frida's podcast? Are you watching Dr. Frida's? And it just felt so good to be out, be meeting people who were so positive, so encouraging. And I did meet people who were already watching. They might be watching that. If you're watching this, Miss Pat Wilker, hey to your daughters. Hey, everybody. If you're watching, then I definitely appreciate you. And I appreciate how warm you made me feel at the Links event. And for the different people I ran into, people who, while we were there having fun, we did also kind of touch and agree on different social issues, political issues, largely that affect all of us and affect the Black community as well. So it was just a really feel good event, good food, good fun, good fellowship. And special shouts out to my auntie, Wanda McCrae, who did a wonderful job, and to my uncle, Dr. Keith McCrae. Thank y'all so much. All right, let's get into the business of medicine in the news. So before we do my favorite game, myth versus fact, I do want to share you some breaking news that I had a chance to share. For those of you who are my members only, check out the members only videos, because I went into detail about being called hot off the press on Friday when the ACIP had a meeting, that advisory committee on immunization practices, the one that RFK appointed. Remember, when RFK Jr. came in, he fired all of the other people from the original CDC's ACIP, hired his own, and they had some votes, and they reversed some major decisions within 48 hours. So check out all of my social media platforms at Dr.Frita. And I post myself because I was called by the Washington, D.C. News, their local Fox 5 D.C., to talk about it as soon as it happened. So I talked about the breaking news. And just to give you a bit of a spoiler, one of the reversals of the decisions included, as of now, at least per the ACIP, the MMRV vaccine, the measles, mumps, rubella, chickenpox, the measles, where we're having the outbreaks higher now than any time in 30 years, and where we've had people who passed away. Yes, that measles. That shot is no longer being recommended, nor will it be covered by government insurance. This is a recommendation by RFK Jr.'s ACIP. So stay tuned. I'll keep you updated on what happens. And again, if you go to my IG, Facebook, TikTok, You Don't Stop, LinkedIn, I did go in there and I put in where I was on Washington, D.C., Fox 5 D.C. News, and you can see where I talked about that hot off the press on Friday, September 19th. All right, that being said, let's go ahead and get this thing going with myth versus fact. Dolly Parton, y'all know, the lovable Dolly Parton, had to cancel a concert because, would you believe, she had a kidney stone? So let's go ahead and play that clip, please, Shador, and let's talk about kidney stones. All right.
Dollywood, it's me. I know, I'm here, and you're there, and you're wondering why that is? Well, I had a little problem. I had a kidney stone. It was causing me a lot of problems. Turned out giving me an infection, and the doctor said, you don't need to be traveling right this minute, so you need a few days to get better. So he suggested I not go to Dollywood today, but I'm there with you in spirit, and I was looking so forward to it because for the last 3 years, Eugene, the team, and I have been working on this wonderful night flight expedition. And it's something they tell me that there's nothing like it in the whole wide world. Certainly not in East Tennessee. They say it's the most expensive thing we've ever done, so that'll be good. I usually don't ride the rides, but this one sounds so magical. I might just check that one out. But seriously, I did want to say again, I'm sorry that I can't be there in person, but you have a great time today. And I know that Eugene is going to tell you all about this. We got great things to show you on the screen. So you just enjoy it and know that I'll be back just quick as I can. Don't worry about me. I'm going to be okay. Just can't do it today.
All right. I tell you, now, don't you know those people were disappointed that she didn't show up, but she could not have delivered that message any better. Just a little bit of humor, just lightness, her own voice. I really like Dolly Parton. That's a class act. I don't like kidney stones though, Shador. So let's go ahead and play our myth versus fact game. But first, who was the first one in the chat today, Shador?
First in the chat today, Miss Aileen.
Hi, Miss Aileen. Welcome back. All right. Myth versus fact statement number 1.
To prevent the most common type of kidney stones, you must completely cut out healthy, high oxalate foods like spinach, nuts, and beets from your diet.
Put an M1 if that's a myth, and F1 if that's a fact. If you're going to prevent those stones, like those calcium oxalate stones, you need to completely cut out foods that are high in oxalate. M1 if that's a myth, F1 if that's a fact. All right, myth versus fact statement number 2.
If you've had one kidney stone, it's unlikely you'll get another one. Most people only have them once in their lives.
All right, once in a lifetime thing, one in a lifetime. M2 if this is a myth, F2 if this is a fact. If you've had one stone, then you're good to go because most people will only get one stone in a lifetime. M2 if that's a myth, F2 if that's a fact. All right, do we have any takers?
Of course we do.
Wonderful. And listen, as we go through these myth versus fact statements, I want you to put stone in the chat and answer this question. What are some signs and symptoms of kidney stones? Write stone in all caps so we can see it real easily, preferably stone, and then put what are some signs and symptoms of kidney stones. All right, myth versus fact statement 2, Shador. Who do we have? What do we have?
Statement. We had to do statement 1 first. Statement 1.
Number 1.
To prevent the most common type of kidney stones, you must completely cut out healthy, high oxalate foods like spinach, nuts, and beets from your diet.
Okay.
All
What
right.
say you? Because you know, when we talk about stones, and we will get into it, oxalate is something that can combine with calcium and cause stones. And things like spinach, nuts, beets, rhubarbs are loaded with oxalate. And yes, these happen to be healthy foods in a lot of ways. So do you have to cut them out completely? What do they say, Shador?
All right. So we have Donna Michi.
Hey, Donna Michi.
Donna Michi says myth.
A myth. So we don't have to cut them all the way out? Okay, Donna Michi. Okay.
Lorena.
Hi, Lorena.
Says myth.
A myth. Okay.
Ellis.
Hi, Ellis.
Ellis says myth as well.
All right.
Over on IG, checking in today.
Hey, IG. Okay, IG, what I have for y'all. I had the video of me being on the breaking news. So I have that for you. Ooh, and I also have a reel that's actually getting quite a lot of views. I was actually kind of surprised at the interest, but I kind of run over the causes of foot and ankle swelling, including liver disease, including congestive heart failure. So check that out over there. And I also did something else, IG. Oh, on Mondays, I do something. I've just kind of started it. On Wednesdays, medical mornings. On Wednesday mornings, I've been over on TikTok doing it, where I do live Q&As and actually call you up to the stage. So anybody here, if you just kind of follow me on TikTok, then you'll see the notification. But on Wednesday morning, I'll actually call you up to the stage and answer questions just for like a half hour or so. But I had one little talk that went slightly left, but I posted that on IG for you too. All right, what's your answer? What's your answer?
Sickle Cell My Story. Hello.
Hello.
Says myth.
A myth. All right.
And One Sister G says myth.
One Sister G. Did anyone say it's a fact?
Miss Aileen said it is a fact.
It's a fact that you need to cut out all the oxalate in your diet. All right. Well, the answer is it's a myth. It's a myth. And I can tell a lot of you are probably good test takers, because anytime you see always, never, completely, you really have to think twice, because oftentimes that extreme answer choice is not correct. But this is not about test taking skills. This is about medical knowledge. So let's talk about it. So it is true. It is true that if you have a high oxalate diet, that oxalate can bind to calcium. And we know that kidney stones are actually made of minerals that stick together, okay, in your kidney system, and they form rocks or stones in your kidneys, just like they sound. And so calcium oxalate, when those bind, they form the most common stone, calcium oxalate. We also have calcium phosphate stones. You can get uric acid stones. There are other types of stones that you can get. But the bottom line is when these different crystals and things floating around in your urine, when they bind together and they stick and literally form stones in your kidneys. It's also called nephrolithiasis. You may have heard it called renal calculi or renal calculus. These are kidney stones. And so it stands to reason that if we know that calcium combining with oxalate is a big cause of kidney stones, well, then Sure, of course, it would make sense to decrease the oxalate in your diet, right? And that's where you're going with it, right, Miss Aileen? The key is because so many foods with oxalate are healthy foods, it's difficult to completely cut them out and still be healthy. Imagine cutting out all the spinach, all the nuts, all the things that I sit here and talk and say that we need to eat. So there's a workaround. There's a workaround. Yes, you can reduce the amount. Like if you're sitting up here having kale salads, kale smoothies 3-4 times a day, sure, you want to cut down on the amount of oxalate you're eating, but you don't have to cut it completely. Here's the trick. If you pair an oxalate meal with a meal that is high in calcium, then the calcium and oxalate will bind together in your gut, in your digestive system, and it's less likely to be absorbed into the rest of your body. And so you're less likely to form a stone. So that's the key. If you simply must have a little kale salad or some nuts, make sure you combine it with a calcium rich food with some calcium. And so that you're less likely to get the stone. So there's a workaround, but certainly decreasing the oxalate in the diet is a good idea. Do not, or it is not recommended to decrease the calcium, interestingly enough. It's not recommended to decrease your calcium from what's recommended, but decreasing the oxalate, but you do not have to cut it out completely. And that myth versus fact question was cutting out those oxalate foods completely. Very good, very good. All right, let's go on to myth versus fact statement number 2.
If you've had one kidney stone, it's unlikely you'll get another one. Most people only have them once in their lifetime. Mixed bag on this one. Mixed bag.
I love a mixed bag. That means we got some learning to do. Good. All right.
Lori, hello, says it's a fact.
It's a fact that if you've only had one stone, then you're good to go. You're not going to likely get any more. All right.
Ronnie agrees it's a fact.
A fact. Once you get one stone and you're over and done with that one, bye. No more stones. Okay.
Marina says myth.
Oh, Marina, why are you going against the grain, Marina? All right. Marina says you get one stone, you might get some more. You might be at higher risk for getting more, huh, Marina?
Shar says myth as well.
Hi, Shar. You said it's a myth. You think if you get one stone, it doesn't mean you're not going to get any more. Okay.
Thomas says fact.
It's a fact. Okay. One and done. Okay.
And Miss Sandy says a myth.
A myth. All right. I love a mixed bag. This is good. The answer is that this is a myth. It's a myth. Getting one stone does not mean that you're one and done, that you won't get another. In fact, if you get one stone, you're actually at an increased risk of getting more. And if you think about it, it really makes sense because whatever it is happening in your body to increase your risk for getting that one stone, if it's not changed, or, if something doesn't happen to, change the chemistry of your urine or how much fluid is in your urine, if it's not changed, then you really could get more stones. In fact, if you have one stone, then you have a 50% chance of getting a second stone within the next 5 to 7 years, unless there is an intervention. Okay. So remember, I wanted you to put stone and put the symptoms of kidney stones, which we'll get to. But first, let me talk a little bit more about stones. Now, Shador, did the image of the kidney stone go through? I saw those images of
yes.
Okay. All right. Let's put up the image of the kidney stone, please. All right. So here we have a beautiful kidney, but it has a few blemishes. Kidney stones. And I told you, it's just like it sounds. It's rocks in your stones. And so, one thing as far as kidney stones, you can have certain conditions that might predispose you, like a rare condition, hyperoxaluria, or actually living with obesity, which is a common condition. Living with obesity can increase your risk for kidney stones. Being dehydrated can increase your risk, and I'll explain to you why. Also, having hyperparathyroidism, which is a condition that can lead to high calcium, that can increase your risk for having kidney stones. And if you have inflammatory bowel disease, something like a Crohn's disease, that can increase your risk for having kidney stones, or gastric bypass surgery. Okay. That affects your absorption of calcium and other vital substances. And that can affect you and increase your risk for having kidney stones. And I mentioned that because you can imagine if you get one stone and you have those risk factors, and the risk factors don't change and the interventions don't change, then sure, you're at risk for having more stones, right? For the same risk factors. So again, the kidney stones develop because we all have different minerals and substances floating around in our urine. And when these minerals, certain ones, find each other, stick together, they form a stone. Here's something that's very important. Staying hydrated is really, really a great way to help to prevent stones. Why? Because you can imagine if you're dehydrated and your urine is concentrated, right? If those particles are in a small amount of fluid, then they'll have an easier time finding each other and sticking together, right? So dehydration leads to concentrated urine and different particles that are close together, right? So they can stick together more likely. But if you're drinking plenty of fluid, consult your doctor to find out what's right for you. But let's just say 2 to 3 liters for most average adults without a whole lot of medical problems, drinking 2 to 3 liters. So I'm talking like 4 to 6, 16-ounce bottles of water. If you're drinking a lot of water, then those particles might be there, but now your urine is dilute and they have a harder time finding each other, right? When you have a more dilute urine that's not concentrated. So remember that. Also, some other ways to prevent kidney stones: having a low salt diet, okay? Having less than 2 grams of sodium or salt per day. Decreasing the oxalate in your diet, although as we talked about, you don't have to completely cut it out. You can pair some oxalate foods with calcium-rich foods. And if you are living with obesity, trying to get to a healthy weight, if you are someone who has Crohn's disease, if you've had a gastric bypass, if you have some other condition, hyperparathyroidism, going to your doctor and getting these underlying conditions treated to the best of your ability. So these are all ways to help to prevent kidney stones. And then there are multiple treatments that are involved. Some could be just a matter of taking some medicines, like some pain medicines, drinking water, and letting the stone pass. Ooh, that can be painful, but that's one way. But if you have a stone that's stuck in there, then you might have to have some type of a procedure like a lithotripsy, where shock waves, like through an ultrasound, will break up the stone and get it out. If it's a really huge stone that won't budge, you might actually have to have an open surgical procedure. And then there are other things in the diet, like increasing citrate. We know that lemons, for example, have a lot of citrate, which can help to decrease the kidney stones, or sometimes taking potassium citrate pills. So there's a mouthful on kidney stones. Make sure that you check out my videos right here on the YouTube channel, The Painful Truth About Kidney Stones. I have a couple of kidney stone videos to give you more information about kidney stones. And for those of you who are new, I am Dr. Frita. I'm a medical doctor. I have been board certified in nephrology. So I am a board certified nephrologist. That means I'm a kidney doctor and a high blood pressure doctor. I've also been board certified in internal medicine, pediatrics, obesity medicine. And so I love to learn a lot about a lot. I read medical journals every single day. And more importantly, I love to come here and to share the information with you. So please make sure that you give us a like on this video and share it. Go ahead and share it while you're on here. Share it to your WhatsApp, your group me, your group chats, and subscribe. We're up to over 899,000 subscribers here on the Dr. Frita YouTube channel. I thank you to all of you who come here to support me. Please spread the word, because we're just a hop, skip, and a jump from 900,000. Thank you so much. All right. So before we move on to this next topic, did anyone comment on what some signs and symptoms of kidney stones are?
Yes, we did have some comments on that. And then once we finish, I do have a question from a member.
Okay. Hello. Welcome.
All right. Limitless Sky.
Hi, Limitless Sky.
Says painful urination.
Yes, literally, you can have pain, because you can imagine as you have the urine flow, Limitless Sky, you might be pushing that kidney stone along with the urine flow. And as it goes down, it's scraping against the walls of your genitourinary system, right? It's scraping against the walls of your kidney system. It can definitely cause pain while urinating. Good.
Sandy.
Hi, Sandy.
Pain in your back.
Pain in your back. That's right. You can have a back pain or a flank pain. And you know, your lower back, like if you pinch, I mean, unless you're real thin, if you're thicker than a Snicker, like some of us, then you might have a little bit of fat in your lower back, or the loved handles. Those loved handles are actually there for a purpose. They protect your kidneys. So your kidneys are in your lower back. So if you have a kidney stone, you really could get low back pain that sometimes will radiate to the front, to where your bladder is, or radiate to the groin. So yes, back pain can occur with kidney stones. Very good, and welcome.
Donna Michi added blood in urine.
Child, yes. Thank you, Donna Michi. You can have blood in urine. So when I did my interpretation of the stone, scraping and scratching, thank you very much for my dramatic interpretation. It literally is. The stone is scratching and scraping inside of your genitourinary system, inside of your kidney. And so, yeah, that can make you bleed, and you can have blood in your urine. Even it can be blood that you can see. We call that gross hematuria. Not like, oh, it's gross. Gross as in you can see it without a microscope. So you can have gross hematuria, Or when your doctor goes and tests your urine, they might come back and say, hey, you had some blood in your urine. You might be like, I did not have blood in my urine. Well, they're talking about microscopic hematuria, blood you can't see. Either way, having a kidney stone can lead to blood in your urine. Good.
Thank you. Marina added to that list vomiting.
Yeah, yes, you can get very, very sick, pain, okay, extreme pain to the point where you are sick and you are vomiting with kidney stones. I've seen it and you are correct. Anyone else? They hit the big ones.
No, those are about all the ones.
Yeah, those are the big ones. If it's really big, your kidney stone, it could cause a blockage and you can get a backup of urine or hydronephrosis. And then, as I believe Sandy said, that can cause kidney pain. And you can also, if you're backing up the urine and it's just sitting there in your kidney, the urine is stagnant, then it can get infected. And so you can get symptoms of a UTI, or you can get symptoms of pyelonephritis if the stone is bad. Okay, very good. All right. So again,
from IG, yes, someone added from IG.
IG, who is this?
Where it goes. Sickle cell says abdominal pain, nausea, bloating, fatigue.
Absolutely, you can get all of those things. We hit on the back pain and the vomiting, but yeah, you can get straight up fatigue. And if you are, you might be moving into the infection phase, like a sepsis, if that happens. Very good.
All right, I have a question from our member.
Hey, Michelle.
Yes.
All right, thank you for being a member. Make sure you check out the members only video I posted. It might have been yesterday, or it could have been Saturday. You know, it was this weekend. I posted a members only video. Make sure you check that out. Okay.
Hi, Michelle. She says, at which point do kidney stones form? Never had a stone. At this point, I have stage 4 CKD. And my doctor has warned me away from everything. This is the concern I had, or can I eat anything?
Oh my goodness. It's very tricky. And thank you for sharing. And I'm sorry that you have that diagnosis. I do want you to know that you are actually at the right place, because all we do all day, every day is talk about diets when it comes to kidney disease and things of that nature. So first things first, how does the kidney stone form? Literally, it forms just by you having whatever calcium, oxalate, uric acid, phosphate floating around in your urine. And all it takes is for these minerals to stick together, to stick to the wall of the kidneys, of someplace within your kidneys. And then once they stick together, then as other particles pass, they stick to the stone, and then you have the stone. Again, if you're very, very well hydrated, that's a great way to decrease it, usually 2 to 3 liters, or perhaps half of your ideal body weight in pounds, drinking that much water, half of your ideal body weight in pounds, that amount of water in ounces can sometimes decrease it. Consult with your doctor. And if it's a case where you have one of those risk factors where you're just highly predisposed, then, you know, you need to talk to your doctor about treating the underlying condition. But bottom line, there's no one magical moment or anything that you do. The particles are in the urine. It's just a matter if they catch you at that right state of dehydration or right state where the substances and particles are high in the blood. It's very tricky. Now, moving on to your diet question, because everyone with CKD is not built the same. Some patients with CKD4 will have a really high potassium because your kidneys are responsible for filtering out excess potassium in the blood. And if the kidneys aren't working well, then oftentimes you'll get high potassium or hyperkalemia. But if you happen to be a person who has normal potassium, then you might be able to eat all the potassium you want. Whereas if you're a person who already has too much potassium in your blood, your doctor may have told you to restrict the potassium. Potassium restrictions are often to less than 2 grams a day. For people with normal amounts of potassium and normal filtering of potassium, it's usually about 4.7 grams a day. I say that to say it's an individual case-by-case scenario. Some patients have to decrease the phosphorus, limit that to 800 milligrams a day, decrease the sodium. That's recommended that everyone, all adults, most adults, decrease sodium to 1,500 milligrams per day. So here's what I recommend. I recommend that you definitely consult with your nephrologist, or, you know, I offer a telehealth concierge service right here. I can see you from anywhere in the world to give my input on you as an individual, because it depends on your labs. It depends on your labs and on your medication, on the best diet. But another great start for you, Michelle, will be to check out some of my videos. I would start with going to CKD stages, where I tell you the likely issues you run into with your electrolyte substances, depending on stages. There are 5 stages, 1 through 5. And then I have a multitude of videos on foods that help to repair kidney disease. I have a video on the top drinks and juices that help your kidneys to filter better. I talk about low sodium diets that are good for most people with high blood pressure and kidney disease. And so I go into detail there. But what I'm offering you here with these videos, it's a supplement to medical knowledge. You absolutely want to consult with your nephrologist. And yes, you definitely should be seeing a nephrologist, a kidney doctor at this point. And certainly I would love to see you in the telehealth concierge service. And even for you, now that you're a member, make sure that you join us on the last Monday of every month. We have a live Q&A, and Michelle, I'll sit up there and I'll talk to you. Now, recognizing for the live Q&A, other members are there too, so you wouldn't have the same privacy. If you want the one-on-one where HIPAA's in effect, then the telehealth concierge service. Thank you for being a member, and I wish you the best of luck with your kidney journey. And kidneys is what I do, okay? So I have a wealth of knowledge for you, and I would love to talk to you one-on-one.
All right. So thank you, Dr.
For anyone else who wants to be a member, make sure you click the link here in the description or go to my one-stop shop, Dr.Frita, and become a member. We have a great time. I give you the members only videos. And again, that live Q&A is something that can really be priceless, where you can come every month just for the membership and you have access to all of my knowledge, decades of knowledge on kidney disease. Okay.
One more question regarding stones. This is from Cheryl.
Hi, Cheryl.
Is it more common in men than in women?
It actually is. That's an interesting question. Yeah, it is. It's more common in men than women. Of course, women can get them too. And I mentioned to you some of the other risk factors, but here's the poor men. Yeah, men, y'all are all right. Here's the thing with men. As you can imagine, when someone born a woman has a kidney stone, yes, the stones are going to come out. They're going to scrape and do whatever they want to do coming down the kidney system. You've got your two kidneys. Okay, then they'll come down the ureter, that tube that connects the kidney to the bladder. Kidney stone will be in the bladder, and then it'll go through the urethra, right? That's the tube that connects your bladder to the outside world. Well, many people report that when that kidney stone is squeezing from the bladder to the outside world and it goes through the urethra, that's really very painful. But for women, okay, the female anatomy, the urethra is short, right? Because the distance from the bladder to the outside world is bloop. But for men, the urethra travels all the way through the male organ. And so it scrapes going all the way down. It just does. And my grown men will cry. And I'm not even kidding. I'm not trying to be horrible, but let's just go with prevention. So everyone listening, please make sure you stay well hydrated, consult with your doctor, lead your healthy lifestyle. But yes, slightly more common in men than women, kidney stones are.
All right. Thank you.
Good question. All right. Shall we move on to our weekly dose? Let's do it. All right. Please make sure you give us a like. We're giving you evidence-based information here. And so now let's talk about our top story in weekly dose. Lori Harvey, you know her, Steve Harvey's daughter, and she's quite the socialite, beautiful young lady. She does modeling. She does brand recognition. She promotes different brands. Everybody's in her business, her Hollywood business, because, she's dated some very interesting people, including Michael B. Jordan. And, we see her as a socialite on the scene, just kind of offering beauty and levity. Well, she's come out with something that's not just so light, something rather heavy. She's sharing where she felt like she was gaslit by her doctors. Let's play that clip and let's talk about it on the other end.
Just as women, it's so normalized for us to kind of just suffer in silence. And so, I had seen doctors in Atlanta when I was there. I saw a few doctors in LA when I moved here. And when you keep telling these doctors who are supposed to be there to help you that you don't feel right and something's off, and they keep telling you you're fine, it's almost like you're getting gaslit, you know? And so then you start questioning yourself. And so then you start to normalize all of these feelings, thinking, okay, cool. They're saying I'm okay and everything's fine. So I guess this is something that I just have to live with. My weight fluctuated like crazy.
Did you have acne?
I did. I have rosacea. So any little thing, my skin will react, get really red, really splotchy, rashes, crazy acne, little like facial hair. I'd have like one little long hair that would grow out of my chin, one long one on my chest. And I was like, what's happening? I feel like just as women, it's so normalized for us to kind of just suffer.
Yeah. So I was actually quite proud of her because, as we know, with all celebrities, they are not obligated to tell us their business. They really are not. But I'm finding that, and like when I come here and we do the celebrity health shador, it actually helps people and it helps them to understand that these things can happen to anyone. And so she shared that she has endometriosis and polycystic ovary syndrome, okay? PCOS and endometriosis. These are not the same diagnoses. These are two separate diagnoses, and it's actually rare to have both. It's rare to have both. So what I want to do now is I want to spend some time talking about the difference between endometriosis and PCOS. And again, each of them is common. It's rare to have both, but just because you have one, it won't ward you off from having the other. And so that makes it tricky to diagnose it because you can't have both. So here's what I want you to do in the chat. Put PCOS for polycystic ovary syndrome. And I want you to give me some symptoms of polycystic ovary syndrome. And if you or a loved one has dealt with it and you care to share a story about your journey in being diagnosed or a treatment that's worked for you, please do. And then put endo, just put ENDO for symptoms of endometriosis. And there might be an overlap, but I do want you to separate those out. PCOS, okay, and then also endo. You can put them in the same question, but put PCOS and put endo and label them so we can see them, please. All right. And so now let's just talk about the difference between endometriosis and PCOS. Let's start with PCOS. So PCOS, or polycystic ovary syndrome, when I was trained, it was called polycystic ovarian syndrome, but it looks like the nomenclature has changed to polycystic ovary syndrome. And this is a disorder that's a result of a hormone imbalance, and that hormone imbalance affects the way that women's ovaries produce eggs. And so what happens is normally, when the menstrual cycle, we have ovaries, and once a month while you're in your stage of fertility, your ovary releases an egg. And if that egg is not fertilized, you have a menstrual cycle, and so on every month. Welcome to our life. Thanks a lot, Eve. But if you have PCOS and you have a hormone imbalance, then that can affect the way that your ovaries release eggs. Your ovary might not even release an egg at all, and you can actually get multiple ovarian cysts, okay, with polycystic ovary syndrome, and it can lead to infertility. It's a very, very, very common cause of infertility. PCOS is. The symptoms, unfortunately, go much farther than just having infertility. There are many physical features that you can get with PCOS, which we'll talk about in just a moment. And it's pretty common. About 1 in 10 women will get PCOS, but by some studies, up to 15% of women will get PCOS. And it's oftentimes not diagnosed properly until a woman is in her 20s and 30s trying to have a baby. She finds out that she has infertility, and then boom, they do some tests and they find out she has PCOS. But quite often the diagnosis is missed. It's missed, which can be really debilitating, which is something that Lori Harvey has described. Now, in order to be diagnosed properly, of course, your doctor will need to do a history and physical, and some of the symptoms that we're going to talk about need to be picked up. And some tests, like testing your testosterone level, you'll have an abnormal elevation in testosterone, along with some of the physical signs that we'll talk about if you have PCOS. But it's definitely something that can be diagnosed with pelvic exam, looking at you through the history and physical, testing your testosterone levels and other hormone levels. So that's PCOS, okay? Now let's talk about endometriosis, which is different. Okay, it's different, but again, it's going to be occurring at the same time, childbearing age, usually between 15 and 44. And I don't know if that image went through or not, but for endometriosis, it's a matter of the tissue being in the wrong place. Okay, so your uterus is lined with endometrial tissue, okay, inside of the womb, inside of your little pear-shaped uterus. Well, in endometriosis, that doggone tissue gets out of there, and you grow endometrial tissue in places outside of the womb, outside of the uterus, where it's not supposed to be. So you see in this picture different places where they point to where the endometriosis is. It could be on your fallopian tubes, it could be on your ovaries, it could be outside of the uterus on the wall instead of inside where it's supposed to be. It can be on your small intestine, your big intestine. And here's the issue. So monthly, Anyone who has gone through menstrual cycles, okay, you will know that, and they're different levels. Some people have very little symptoms, some have extreme, but there's oftentimes a lot of pain and cramping and just inflammation, monthly during the menstrual cycle. Well, imagine if you have that tissue, the endometrial tissue, and it's on other organs. Well, guess what? That tissue will still lead to inflammation and pain. Only now, instead of it being concentrated mainly within the uterus, within the womb, your entire abdomen will have pain, like debilitating pain, not just during your menstrual cycle. It could be before, after. It can really be chronic pain. And we heard that Lori Harvey said that her cycles would be so intensely painful that she would feel like she needed to go to the hospital every single month. And I'm so sorry that she had to live through that. And other patients I've encountered have had to live through that. And they're told, just take some Advil, take some Tylenol. Oftentimes it's minimized, like, be a woman. This is what you go through. So I'm glad that she's speaking up, because oftentimes women's issues are minimized. So that's the difference. With polycystic ovary syndrome, there's a hormonal issue that's causing you to have multiple cysts inside of your ovary, and the egg sometimes is not being released. You can have infertility. With the endometriosis, the tissue is in the wrong place. Instead of just being inside of the uterus, you have endometrial tissue all over, causing pain and inflammation. Now, let's talk about some more of these signs and symptoms. Did anyone put any PCOS symptoms or any endometriosis symptoms, Shador?
Yes, a few.
Okay.
Sandy for
Hi,
PCOS.
Sandy.
Very heavy, very heavy bleeding in periods, and hers never came on time.
Okay, so irregular menstrual cycles and heavy bleeding. Absolutely. That's true. That can happen. And that can happen with both, actually, endometriosis, and it can happen with PCOS. The irregularity is key. Mm-hmm.
All right. I remember Miss Elaine.
Hi, Miss Elaine. Thank you for being a member.
For endo, she put very painful menstruation and prolonged and heavy bleeding.
Very good. Endometriosis. So again, you have the endometrial tissue that's supposed to be inside of the uterus. It's everywhere. So you're getting pain, abnormal bleeding, irregular periods, all of that. And that can happen, again, for both. Okay. And we're going to talk about some symptoms that are more distinct to PCOS in just a little bit.
All right. T Chosen. Hello.
Hi, T Chosen one.
T Chosen said for both PCOS and endo, horrible cramps.
Absolutely. Horrible cramps to make you want to go to the hospital, like Lori Harvey said she felt like doing. Good.
All right. That's all that's chimed in for now.
Okay, very good. So now let's talk about PCOS. And she hit on this one. Acne. Okay, she mentioned that she had rosacea. And so it's tricky when you already have another dermatologic condition, but PCOS can put you at risk for having heavy acne. And it can be really bad. It can be cystic acne. It can be scar leaving acne, but having acne is a big symptom that can be with PCOS. Also, and this is one that my female patients, my women cannot stand, abnormal hair growth. Okay. My young ladies getting hair on their faces like beards, no joke. Hair on the chest. Okay. Hair on the back. Thick, coarse hair in places where it typically does not grow in women. And this can really be socially upsetting, and it can affect your social life if literally you're growing hair on your face heavily. So if you're someone who's getting acne, if you're someone who's growing hair in abnormal places, especially if you're having irregular menstrual cycles, or if you've tried to get pregnant and you're having some signs of infertility, talk to your doctor and say, hey, could I have PCOS? Okay. And so you can also get insulin resistance, really with PCOS, more likely, where you might have a high hemoglobin A1C, pre-diabetes, even diabetes. Okay. Which is why one of the treatments for some patients with PCOS is metformin. Okay. Certainly trying to get to a healthy weight as well. And if you are not trying to have a baby, then treatment for PCOS can be like, hormone therapy. Okay. An IUD, birth control pills, things of that nature. If you are trying to have a baby, there's certain medications that can help you to ovulate or even release more eggs. And in some cases, you might need to go into intrauterine implant. You might need to have IVF or go into more invasive ways, but make sure you consult with your doctor, consult with your OBGYN, and really ask about at what point should you be referred to a fertility specialist if you have a diagnosis of PCOS and you're trying to have a baby. So yeah, the hair, the acne, you can even get hair loss. Look, hair loss on your head, but hair growing on your chest and your face with the PCOS. Those are big ones. And you all already hit on the major ones with endometriosis endometriosis. And it's mainly the debilitating pain, prolonged periods, abnormal periods, and then just fatigue. Okay. And of course, you can even get anemia if you're having these heavy periods. And again, the endometriosis, approximately 11% of women will get them. They're both pretty common, the PCOS and the endometriosis. There are causes of infertility, of pain. And in Lori Harvey's case, it sounds like she said that she had both. And so I thank Lori Harvey for sharing her story. And I want to ask this question. Before hearing Lori Harvey's story, did you know the difference between endometriosis and PCOS? So you can put that in, and we'll go ahead and keep moving. And again, give us a like, por favor. Give us a like, give us a share. Make sure you subscribe to the YouTube channel, Dr. Frita. Follow me on all platforms because I give you different information on different platforms. All right, let's move on to the next story, and let's talk about what time it is. Did you know that the Apple Watch can now in the future tell you your blood pressure? Let's play that clip, please, Shador.
All right.
This year, we're thrilled to share our next advancement focused on a problem of massive proportions, high blood pressure, also known as hypertension. It impacts approximately 1.3 billion adults worldwide. The American Heart Association has referred to it as a silent killer because it often occurs with no obvious symptoms. To help, we've developed a groundbreaking feature that can alert you to possible hypertension just by wearing your Apple Watch. Using data from the optical heart sensor, the algorithm looks for chronic high blood pressure by analyzing how your blood vessels respond to beats of the heart. The algorithm works in the background, reviewing data over 30-day periods, and will notify you if it identifies patterns of hypertension. We've developed this novel approach using advanced machine learning methods and a series of studies totaling over 100,000 participants. While it won't detect all instances of hypertension, we expect to notify over 1 million people with undiagnosed hypertension in the first year alone.
All right. Let me ask this. And if y'all answer this one, put Apple, write Apple or put an Apple emoji. Do you or someone you know, do you use an Apple Watch to track your health? But yeah, that's actually, and for me as a board certified high blood pressure doctor, this is pretty exciting for me. I'm really curious to see the studies. And once this is really, released, to see just how accurate the Apple Watch is. But there are ways, to pick up parameters. And I've seen other smart devices that check blood pressure. And I'll be honest, I've been amazed that they've been pretty accurate, a lot of the ones I've seen. And we know that, as they mentioned, 1.3 billion people worldwide have high blood pressure. And right here in the United States, according to the CDC, we have almost half of the people diagnosed with high blood pressure don't know it. And we know that high blood pressure is a leading cause of heart disease, strokes. It's the number 2 cause of kidney failure. Make sure that if you don't have it already, you click the link in my bio to get my book, Under Pressure, A Guide to Controlling High Blood Pressure. I talk about not just using medicine to lower your blood pressure, but also using holistic measures, ways to lower your blood pressure naturally. But certainly, if all these people who wear Apple Watches for fitness, for keeping up with their schedules, for other things, if that feature is now being added and you're told you have high blood pressure, of course, you don't do anything without your doctor's input. But if it's just enough for a person who didn't know they have high blood pressure to at least go to their physician and find out that they have the diagnosis, and if they're able to be managed, this could be a serious game changer in decreasing the effects of high blood pressure, not just in our country, but worldwide. So I'm actually pretty excited about it. All right. Did anyone comment if they or if someone they know uses the Apple Watch?
Yeah, a few people chimed in. Miss Aileen.
Hi, Miss Aileen.
Yes, Shar.
Hi, Shar.
Marcella from Facebook.
All of y'all use the Apple Watch to help track your health?
Mm-hmm.
I don't even have one. My both of my daughters have one. My son never wanted one, and I haven't had one, even though I use a lot of Apple products. They have a lot of good features, the Apple products. So this might make me think about it though. Okay. And I know I have a family member. Oh, and she uses her Apple Watch, and she was I'll say she was seeing about my kids and kind of taking them places, taking care of them, feeding them, and just enjoying time with them. And she actually shared that all of her health parameters were improved while she was spending time with them.
Oh.
Yeah. And I'll go ahead and say it's their grandmother. They're
That's sweet.
my yeah. And so
They,
that
didn't,
that
they,
made me
didn't, they
feel.
didn't raise the blood pressure. That's
They
good.
did not raise her blood pressure. They did not raise her blood pressure. My mother-in-law said her health parameters were improved when she was with the kids. And that just touched me so much. Anyway, so yeah. So, all right, here's the Apple Watch trying to help us to improve our health. Now, you know what might not be helping us with our health, Shador?
Mm-mm.
Some airplanes. Listen, there have been reports that there are toxic fumes 30,000 feet in altitude, cabin fumes. Y'all know good and well y'all like to fly. Y'all put all your coins together because you can't stand being in the car for hours. But there's something called aerotoxic syndrome where literally you can be inhaling toxic fumes when you are in flight. Let's talk about it. Let's play the clip, please, Jador.
A new Wall Street Journal investigation says across airlines, the rate of flights with toxic fumes is accelerating, spiking in 2017, driven in large part by leaks on a particular Airbus jet, the A320.
That kind of raised that question. Well, what changed in 2017?
According to the journal's review of internal documents, Airbus loosened maintenance rules following suspected fume events.
An aircraft would have an event, the issue wouldn't be dealt with and then be sent back into the skies regardless.
In a statement to ABC News, Airbus says its aircraft are designed and manufactured according to all relevant and applicable airworthiness requirements. The journal says a neurologist has treated about a dozen pilots and more than 100 flight attendants for what has been described as brain injuries after alleged exposure to fumes on planes over the last 20 years.
Our union has been concerned about this for decades, and we've been concerned about it because of the very real life consequences that crew members have faced.
On most planes, air is pulled in from the outside through engines. So if any seals are worn or degraded, oils from lubricated bearings enter the air and vaporize heat, releasing unknown quantities of toxic compounds, according to the Wall Street Journal report. But not all smells or vapors are toxic. The FAA telling us they are rare. Quote, studies have shown cabin air is as good as or better than the air found in offices and homes, adding that airlines are required to report such fume events to them.
Just one more thing, Shador. Just one more thing. Let me ask y'all in the chat, and I want you to put airplane, okay, and tell me, have you ever felt sick after being on a flight? Okay, and like especially if you haven't been able to pinpoint why, have you ever felt sick? I'm not trying to make up stuff or have you make up stuff or put it in your head, but now that you know there's something called aerotoxic syndrome, it's real. So what happens is, so typically in the air, as they were describing, the air in the cabinets is brought in through the engine and it's filtered, right? It's filtered to keep toxins out. But if there's a breakdown in certain seals, if there's a breakdown, then you can get some of these toxic fumes like organophosphates, TCP, and this can cause you to have a sickness. Most immediately, it can cause headache, it can cause dizziness, it can cause some nausea, but there literally is an aerotoxic syndrome that's long-term, and it can cause you to have memory problems, concentration issues. Okay. And so it's a real thing. And I know I've been in there, the airplane, and sometimes I'm like, oh, is that a fume? Or maybe it's just air from the actual air conditioning. And it probably is just okay, but I just read too much sometimes. But now that we know, I mean, it really is something called aerotoxic syndrome. Sometimes these systems are not fail proof. They can fail. Hey, it happens. Here's the good news. According to a study, and this is a study that was done by the FAA, for what it's worth, it was done kind of internally by the FAA. They said that the release of these toxic fumes occurs in about 1 in 5,000 flights. Okay, 1 in 5,000 flights. And so it's rare. Look, but if you're that one, it's not rare to you. So it's just important to be aware that it's something that exists. And especially for those of you who are listening, who are flight attendants, certainly pilots, or if you're someone who's a business person and you travel a lot for business and you're back and forth in a plane several times a week or sometimes more than once in a day, just something to think about, something to be aware. Perhaps even, when you go on to the flight, you can ask the flight attendants not to get on their nerves. Are you aware of aerotoxic syndrome? Have y'all had any incidents, or how often do you have incidents where there are leaks of toxic fumes? Look, I ask people questions like that. Maybe that's why no one likes to fly with me. I don't know. But did anyone say if they've ever felt sick after a flight?
Pam said no.
Good.
Swansley says I fly very often, never feel ill at all.
Good. Okay, good.
Knick-knack says yes, I call it plain flu.
Okay, plain flu. And so I'm more now if it's happening to you often, if we are to believe this study that the actual toxins are released at 1 in 5,000 flights, then there might be a different reason for you having the sickness in the air other than air fumes. But it's just kind of food for thought. And I'm sorry that you get the what you call the air flu. I would consult with your doctor and kind of find out, are you having some type of a disequilibrium or something that's occurring? Is there some type of anxiety that's hitting when you start thinking about not being in control of the plane? You know, does it cause you an anxiety that causes a physical illness? Mind, body, soul, honey, it's all connected. All right. Thank you, Nick Nack. All right. Anyone else?
Yes. Bias says airplane no so far.
Good. All right. I pray you don't get sick. Good.
Angela said yes.
Okay. So again, if it's really infrequent, you know, because they're saying this is something that happens really infrequently, then again, if we believe that study, then it's not likely from aerotoxic fumes, but it's still a question that I would ask, you know, if you're concerned, you know, hey, how often do you guys get leaks? This is just one of those things where it's food for thought. I'm certainly not saying, yeah, everybody stop flying. I'm not going to stop flying. I promise you that. But just food for thought that these things can occur. It's a real thing. Organophosphates, TCP, can cause an aerotoxic syndrome, headaches, dizziness, nausea. Okay, so especially if everybody who's flying gets the same symptoms, like your whole party, or you get the same symptoms, something to think about. And if you're someone who flies often, pilot, flight attendant, and you're getting memory loss, concentration, something to ask about. Okay. All right. Give us a like. Give us a like. Give us a follow. Follow me at Dr.Frita on all platforms, please. And, you know, do y'all like to dance? I tell y'all right now, dancing is my favorite form of exercise. Dancing also helps you to lower your blood pressure naturally. When you finish with this live, make sure you check out my video, top 10 exercises to help you lower your blood pressure the natural way. Yes, dancing is one of them. Okay, so don't play with me, but it's actually not the one that's found to be most effective. Should I tell y'all? Yeah, go watch the video. But I will tell you, the exercise that's most effective in lowering your blood pressure the natural way, isometric exercises like holding planks, doing wall sits, squats. It's really quite amazing. I love that video because it shocked me on which ones were the best. But anyway, dancing is one of them. And I'm sure that Carrie Ann Inaba can tell you the same because she's a Dancing with the Stars celebrity. But right now, she's not in the headlines about Dancing with the Stars. She's in the headlines because she shared that she's had some serious medical issues, multiple chronic illnesses that aren't obvious. These invisible illnesses.
But, you know, I think for me, the biggest thing that I've dealt with is health.
Yeah.
Because I was diagnosed with lupus and a variety, Sjogren's syndrome, fibromyalgia, antiphospholipid syndrome, a variety of autoimmune conditions. And so for the last few years, I've been really struggling with my health.
Mm-hmm. I've read a lot about, first of all, thank you for being so open, because I know that in your journey as a celebrity and sharing that, it's caused you to be vulnerable. It's talking about personal medical health, but it inspires people who have those same things. So thank you for sharing that.
Thank you.
It's not easy. It's not easy. Also, while dealing with the medical treatment, how does it impact your day-to-day life?
Well, you know, there were a couple of years there. I think when my dad died in 1993, I kind of went downhill because sometimes you were talking about inflammation earlier, right? And I had inflammation not only in my body and my tissues, but also like in my brain, like depression and anxiety and sadness and unresolved trauma. And so I spent the last 2 years actively only focused on my health. I went to see a brain expert. I went to see a psychiatrist. I went to see like a medical medium. I was getting body work, Reiki. You know, don't stop. Like I did not stop because I wanted to find answers.
I love that you've combined modern science with holistic traditional approach. I think that's something that we don't talk about that often.
I think that when it comes to your health, which is the most valuable gift, that you have to go wherever that feels right for you and ask questions and be your own advocate.
I love that. And when she said lupus and Sjogren's and fibromyalgia, and so she listed a lot of what's believed to be autoimmune diseases, especially the lupus, the Sjogren's. And you recall when we talk about autoimmune diseases, that's when your body's antibodies, instead of just fighting bacteria and germs that your antibodies are supposed to fight, those antibodies turn on you and start fighting yourself. They start attacking you. So the same way that an autobiography is a book that's about oneself, an autoimmune disease is a disease where your immune system attacks oneself. Your immune system attacks you. And just like I said, that, the endometriosis having that at the same time as PCOS, how that's not common. It's not common to have that many autoimmune diseases that she's having, but this is her luck of the draw. And it reminds us that, having illnesses, diseases is not just for everyday people, certainly not just for people with low income struggling. It can happen to anyone. You can have all the resources in the world, which she, in that interview, talks about how she's very grateful for her resources. It still doesn't make her not have the disease. And so we'll talk a little bit more about invisible diseases, just like we talked about last week with Selena Gomez. But I do want to ask the question, and I want you and you could just put a CI in the chat, okay, for her initials. Put a CI. Hearing her story on how she had so many kind of non-specific symptoms, and it actually did end up being something, a diagnosis, a manageable diagnosis or diagnoses. Does listening to her story change anything about what you're thinking about your own health or a loved one's health? Okay. Does listening to Carrie Ananaba's story change what you're thinking about your own health and pursuing, treatment or going and giving a loved one some information? Okay. Does it change anything, or does it reinforce something that you're already doing? And I'll tell you why I ask. I have so many patients, and many of which I'm the person by the time they see me who diagnoses them with lupus or Sjogren's or scleroderma, because I do screen for autoimmune disease when people see me about kidney disease. And so many will tell me that for years and years and years, they were told, oh, we haven't found anything. Oh, are you stressed? Are you getting enough sleep? Pretty much told, for the most part, that's in their head. Or they feel that they're being told that they are, a hypochondriac, or they just are having they're overreacting, or they're being hysterical, things like that, being gaslit, in the words of Lori Harvey. So there's so many people, and especially if you go to someone and you say, I have a headache, and I'm nauseated, and my knee hurts sometimes, and my pinky toe hurts sometimes, and I get tingly. If you start giving people symptoms from all over the place, then, and you are complaining a lot and you're tired, but you look fine because it's an invisible disease, then sometimes you will be dismissed. Okay. And you might get discouraged. But I like the point of Carrie Ananaba, because she was like, just don't give up, be persistent. And granted, she has more resources than many people, but still, be your own advocate. And that's really a big reason why right here on the Dr. Frita YouTube channel, I do the videos that I do, is to give you information about disorders or diseases that aren't necessarily common. And when you look at videos, like the video I have on lupus explained, or you look at a video, that I have on other diseases, on high blood pressure, on kidney disease, if you look at these videos, then they will often give you information, okay, that you might not necessarily have on your own. So then when you go in to see your doctor, instead of just being dismissed, you might be able to say, well, you know what? Well, can you please check me for an ANA? Okay. Just a second. You can say, can you please screen me for autoimmune disease? That's not a very expensive test. Okay. But sometimes if you don't mention it to your doctor, it's not in the regular battery of tests. And so they might not do it. And so my point is, be your own advocate. Even if you're being told no and nothing's wrong with you, if you know that something is wrong with you, keep asking your doctor. Get a second opinion. Okay. That is your right. But yeah, so I really appreciate her for sharing her story, sharing her journey. And she looks like nothing's wrong with her. She looks beautiful. She looks like $1 million. Like nobody's going to look at her and say, oh, you look sick. But just as sure as she has those diagnoses, she's been having some suffering going on. All right. So is there anyone who commented on how listening to her might change or influence them at all?
No comments on that.
Okay. All right. Good deal. All right. And do we have any questions, or kind of going back, anyone with the Lori Harvey?
We do.
Okay.
I want to shout out our member, Miss Andrea, for being with us today.
Okay.
And Miss Cynthia as well.
Hi, Miss Andrea. Hi, Miss Cynthia. Thank you for being members. Okay. Give me just a second. while you kind of let me know whatever questions or comments. You said we have a couple questions or comments?
Yes.
Okay, give me just a second.
Okay.
All right. What questions do we have?
All right. This is by my member, Miss Elaine.
Hi, Miss Elaine. Thank you for being a member.
What causes kidney cysts?
That's a good one. Because listen, Miss Elaine. So of course, when you see a kidney doctor, or sometimes if you're just, for somebody who's getting an ultrasound of their abdomen or CAT scan for another reason, they're told you have multiple cysts. You have a simple cyst of 2 centimeters in your left kidney. You have 4 cysts. So here's a story on cysts. Oftentimes, if you are someone who has some form of chronic kidney disease, I don't mean kidney disease, kidney failure, on dialysis, need a transplant, but if you have an EGFR, especially if it's even less than 90, like less than 90%, then your normal kidney cells may form a cyst, meaning just a fluid-filled collection, and it's completely benign. Okay. There's nothing that you do. It's not from smoking. It's not from drinking. It's not from partying all night long. It's just a simple cyst that forms. It's benign. You don't bother it. It won't bother you. It tends to stay the same size. And so it is common to have simple cysts in your kidneys. Here's where it becomes an issue. If you start to get multiple cysts, okay, then you can have something that is polycystic kidney disease. And it's not necessarily the polycystic kidney disease that is the genetic one that leads to kidney failure, but there are different levels. So if you get multiple cysts, that can be an issue, but again, oftentimes associated with chronic kidney disease and people who have high blood pressure. But again, these are benign. Okay. If they're telling you it is a simple cyst, then we're talking about something that's benign, non-cancerous, nothing that is worrisome for your health, but you just definitely want to correlate it with your kidney function to see if you have any issue with your kidney function. Now, there is a syndrome called ADPKD, autosomal dominant polycystic kidney disease. That is more serious, and that's genetic. It's inherited in an autosomal dominant fashion, meaning if you have that, then more likely than not, then you have a close relative with it. One of your parents, siblings, your aunties, your grandma, someone else will have it if it's autosomal dominant polycystic kidney disease, assuming it's not some spontaneous mutation. Okay. But for that one, if you have autosomal dominant kidney disease and you have a child, for example, then with each child, that child has a 50% chance of having it. With that, the cysts aren't just a matter of little tiny 2 centimeter, 1 centimeter cysts. We're talking about multiple cysts that can get very large. Typically, kidneys are anywhere from 9 to 11 centimeters each, not too big, 9 to 11 centimeters, like less than a ruler size. With people with autosomal dominant polycystic kidney disease, the kidneys can get huge, 16 centimeters, 18 centimeters, and they can bulk out and give you a protrusion. They can make non-pregnant women look pregnant. They can cause bleeding. They can get infected. And very importantly, they are associated with high blood pressure and can be associated with kidney failure. In other words, if you have autosomal dominant polycystic kidney disease, you are at very high risk of having high blood pressure and of ultimately developing kidney failure, requiring a transplant or dialysis. Now, that's something that's serious. Back early in my training, we really didn't have any treatment at all. You just try to control the blood pressure, low salt diet, exercise, water drinking, and we just kind of looked at our watches and waited to see if the kidneys failed. Now, fortunately, we do have some FDA-approved treatments, okay, to help to slow down the progression of kidney cysts. And fortunately, also with our technology and with kidney transplants, if we know that you have the autosomal dominant ADPKD, the autosomal dominant polycystic kidney disease, that's a tongue twister. If we know that you have it, then we can set you up, your nephrologist, or we can put you in position where you can get a preemptive kidney transplant, meaning that before ever even needing to go on dialysis, you can get a kidney transplant. Okay. If we follow you early enough, we can help to set that up. So The better case scenario will be if what you're asking about or what you or a loved one's been told is a simple cyst, because in that case, you don't bother it, it won't bother you. Now, if it's a complex cyst, or if they tell you there are multiple septi or lines or different things, or then it needs to be evaluated to make sure it's nothing that's worrisome, like a renal cell carcinoma. But if it's declared as a simple cyst, you have one or two, then it's benign.
All right, thank you, Dr. Frita. And then I just asked this question from Ike. He was joining us today on YouTube and IG.
Oh, no, you didn't. Thank you.
Ike says, I survived an aortic dissection and now have one kidney due to a AAA surgery. The aorta is separated from my kidneys, which now having one kidney, is the creatinine level important?
Absolutely. Number one, I'm so thankful that you are still here. I know I'm not the first doctor to tell you that surviving an abdominal aortic aneurysm, okay, a dissecting aortic aneurysm, that is life threatening, okay? And I can remember just about each patient I've had who's not made it, okay? And I remember the patients who thankfully have made it. And why have they been my patients? Because many of them develop kidney failure, because as you're stating, that aorta, and we know that the aorta is the biggest artery on your body, okay? That's that one that comes right out of the heart, the left ventricle, and that's that big artery that branches off to supply the oxygenated blood to all of your body. With it being the biggest artery, it also has the biggest force, right? So with each pump, boom, boom, a lot of pressure. So when you have a dissection, okay, when there is an area in the wall of the aorta that comes apart a little bit, there's a space, it dissects, then with each pumping of the blood, that blood kind of goes into the wall, meaning it's not going to the rest of your body. So you're not getting effective blood supply. And coming right off of the aorta in your stomach, the abdominal aortic area, okay, coming right off of the aorta. Ooh, see, had I known you're going to ask I guess I can't know if you're going to ask the question. I would have had me a diagram, but the kidney arteries or the renal arteries come right off of the aorta, okay? So if you imagine the aorta being a big tube going down your stomach, down your abdomen, then as you get lower, close to the belly button level, T10, something like that, thoracic level 10, as you get closer to there, then you get kidney arteries that come off. So you can imagine if you have a compromised blood supply from surviving this aortic aneurysm, this dissecting aortic aneurysm, then now your kidney's not going to get the proper blood supply. I'm glad that it only happened with one. I wish it didn't happen to either of your kidneys, but if it had to happen, I'm glad it only happened to one, because you only need one kidney to live and to live well, okay? If only the one kidney were affected and the other kidney was absolutely not affected, then that one kidney can bulk up and do the work of two, okay? You're not necessarily stuck with just half your kidney function. If that other kidney had been compromised, like if you had long-term high blood pressure or perhaps diabetes, that's another issue. But the way we know is the creatinine. And so the answer to your question, is the creatinine important? Was that the question?
Yes.
Yes, it is very important. And I want you to know your numbers. Your creatinine is the marker for your kidney function. And it's a byproduct of your muscle, actually. So here's the deal. For your creatinine, the lower, the better. Okay, just as a round number, most of us kidney doctors like it to be less than 1. Why? Because if your kidneys are getting rid of your creatinine, we know that they're getting rid of other poisons and toxins. Okay, so it's a marker for how your kidneys are functioning. When that creatinine starts to get high, 1.2, 1.4, 1.7, 2. If that creatinine is getting high, we know your kidneys are not getting rid of creatinine. Therefore, they're not getting rid of other toxins. And we know that your kidneys aren't working as well. So your creatinine is a marker of how well your kidneys are functioning. We take that creatinine and we calculate all kinds of other things like your EGFR, estimated glomerular filtration rate. There are other things we look at. I tell you this, again, I'm very excited that you are here and that you live to tell the story. And I want to help you definitely to preserve your kidneys along with all of your organs. I want you to check out my video right here on this Dr. Frita YouTube channel, CKD stages. CKD stages. And when you check out the video, have your My Chart near you so you can see your BUN, your creatinine, your phosphorus, your other numbers. I break down stages of kidney disease, and I want you to look at that and see if based on your creatinine or your EGFR, if you fall into one of those categories, okay? If you do, specifically if you are CKD 3, 4, or even 5, then make sure that you talk to your doctor and ask to be referred to a kidney doctor. Okay. If you are anything other than stage 1 or 2, then ask to see a kidney doctor. And really, with you only having one kidney doctor, I recommend that you ask to be referred to a kidney doctor anyway, a nephrologist if you haven't already. And again, I offer a telehealth concierge service where I'm happy to have a full conversation, take your full history, and we can have a one-on-one conversation from anywhere in the world. But thank you for your question. That's a really important question. Again,
Absolutely.
I'm glad that you lived to tell it. Mhm.
Thank you, Dr. Frita. That's people showing their love, and we'll be out of here, Dr. Frita. From
Okay.
Izzy says my favorite doc with love from the UK.
Yeah, thank you from the UK. Oh, you know what? Y'all are shady in the UK. I won't talk about the news too much, but y'all know what y'all did, projecting certain images on the side of castles. But thank you so much for watching from the UK. I appreciate your support.
And Thomas, I believe from Ireland. Hello, Dr. Frita. You run a great show. Dr. Phil became famous for being a guest on Oprah. You became famous because everybody loves you.
Oh, I love you right back. I appreciate you so much. Thank you for your support from Ireland. All right. And for everyone watching, not just IG, Facebook, those of y'all in the replay crew, I see you. I know y'all are coming back after work and watching. Please make sure you give us a like, give us a subscribe. When I come talk to y'all next week, I want to be over 900,000. I'm thankful for the 899,000 subscribers we have. And make sure you follow me on all social media platforms because I give you different information. And remember, check out TikTok because I'm going to give you notifications for medical mornings. Right now, I'm doing them on Wednesday morning where you can come up to the stage and ask me your question. The full time is up for questions and answers on medical mornings. All right. I don't know how long I'm going to do it. Y'all, you know, life is an experiment. All right. That was really, really great. That was very kind. Thank you. All right. And thank you to everyone who joined us here today. I really appreciate you. Shador, you know, I always appreciate you for doing an excellent job of being a host. For those photos I was talking about that I thought I sent, and child, I didn't send them. They didn't go through. iPhone. Okay. The Apple Watch is good for blood pressure, but sometimes look, anyway. But check out my IG story. I did put some pictures up of my Auntie Wanda, my uncle, Dr. Keith, my cousins, Mrs. Pat Wilker. I have them on my IG story at Dr.Frita. I'll probably do a full video later. But again, make sure you give us a like, give us a subscribe. Check out my book, Under Pressure, A Guide to Controlling High Blood Pressure. Check out our podcast, okay? If you think that you can survive without seeing our lovely faces, but just want to listen to our voices, then we do have a podcast where you can listen to us while you multitask, while you fold the clothes, while you walk the dogs, while you do whatever. You can listen to us where we give you the same wonderful evidence-based medication information on the Happy Healthy Life with Dr. Frita podcast. All right. As always, I appreciate y'all. I thank you for joining. We'll see you next week. Same bat time, same bat place. Check out my other social media platforms where I told you I did that breaking news from September 19th. I have that posted on the IG, Facebook, TikTok, and everything where I tell you my comments. And again, that's why I say subscribe to all social media platforms. It's different information on different platforms. So check that out. But again, alas, I appreciate y'all for being here. I thank you for making Monday your healthiest day of the week.